Hi, this is Dr. Tuan Tran, and today, as promised, at 3:30, we are going to talk about breast implants. Because this is a Women History Month, so we have a special promotion for breast augmentation, the first time ever, for $5,000 for a pair of fifth generation Mentor memory gel implants. Only 5,000. That's the deal. Anyway, let's talk about breast augmentations and implants in general. Feel free to ask any question if you have any question. Okay. So the breast implant. So typically, it's the implant material comes in two different varieties. The first variety is silicone implants, and it's been around since 1963. It has gone through 5 generations, and every time they improve the texture, the cohesiveness of the implant itself, and as such, it's becoming more and more safe with less problematic of silicone material leaking out and being taken up by your lymphocyte and go to your armpits. Or in some cases, when I was a fellow at the University of Miami, I saw a case where the patient get silicone injection into the breast and it went all the way into her lungs, which was kind of crazy. That I remove fair amount of 30 or 40 years old implants. These are second or third generations, and when you basically open up the breast pocket, I mean the implant just disintegrates right in front of you. But now, and I also do a lot of removal of recent implants for two things that we need to touch later. Number one is breast implant associated anaplastic large cell lymphoma, which is kind of like, it's not a cancer, it's a Hodgkin lymphoma type that basically is in the fluid or around the capsules of the implants, that the treatment is if you remove the capsule and the implant, you pretty much treat it. And the incidence for that is very, very low. Most of those are related to texture implants, and because people use a lot of elegant implants, and they report a lot of elegant texture implants. Therefore, in the last several years, elegant texture implants have been recalled, and Elegant has been doing a great job proactively recalling all of these implants. So if you unfortunately have one of these, you may want to contact Elegant. I think that they honor their recall. Therefore, in my practice, I usually put in smooth round implants now, so predominantly. And then the other condition that I want to touch on is the breast implant illness. We do not know there is a direct correlation. However, some patients did communicate with me and experience some of these symptoms, which when I do more research, it seems to be a real thing. The patient has fatigue, brain fog. Patient also has joint pain, and some other systemic condition in their body, weight gain, for instance, some hair loss, things like that. It's kind of wild, but these are things that I can, I've come across and consulted with a lot of my patients. So if they and because of that, they want the implant to be removed. So what I do is that I go through the old incision that they had before, and then I basically dissect out the entire capsules around their breast implant, and then remove them en bloc. And because of that, I do open up the capsule and look at these new generation of implants. I just removed one today from 2014, and they're like fourth generations, and they're very cohesive, and I put tons of these in a patient too, and they're very safe this time. There's a company out there, it's called Ideal Implant, where they have 2 layers of saline pockets, so supposed to feel like a a silicone implant without the concern of silicone toxicosis, which presumably if your silicone implant rupture, silicone can extravasate to different area of your body or cause or incite inflammatory response in your breast pocket, things like that. Let's touch on the saline implants. Basically, it's a very safe implant, the very low leak rate, and basically you put it as a shelf and then you inflate that. And it's very safe because saline is basically the same molarity as your blood. So if it ruptures, all your saline will be absorbed by your body, and you'll be okay. You would know that you rupture right away because one side of your breast will inflate, and you know that. On the contrary, if the silicone implant, if it rupture, you would never know. In the past, the FDA, it's not in the past, but right now, FDA recommends that after you have silicone implants, 3 years after silicone implant, you should get an MRI to monitor if it's rupture. That rupture rate after 3 years is minuscule. However, as you go up in years, supposedly there's an increase in 1% of complication. So when you come in for a consultation with me, we usually talk about your desire and what you imagine yourself and what you imagine to look like after breast implants. And obviously we have to evaluate you. We have to examine your breasts and see if you are an appropriate candidate for breast implant or not. Sometimes your breasts are too saggy. You might need a lift. And sometimes you need both volume and a lift. So you need what we call it augmentation mastopexy. So it's really individualized. And typically I use sizers, and you're gonna come in and then you're gonna put the implant sizer, sizing system for Mentor underneath your bra, and you see what is an appropriate volume for you. This is 450 cc, you see, and then you look at yourself in the mirror, and then I'm examining you, and then we decide if this is the right volume for you, and then we talk about whether you want me to approach the placing of this implant. Is it around the nipple, underneath your breast, from your axilla? With the silicone implant, I cannot do tuba, which is transumbilical breast augmentation. It usually is an endoscopic approach with saline implant that's well rolled up, and then after I dissect the pocket, we'll be able to put the implants in your breast pocket and then inflate with saline. So I don't do tuba, but the other three are fair game. So that being said, the most common approach in America is the inframemory fold incision. For the surgeon, we get better dissection that way. We get better control of bleeding. We can see everything clearly. We get a more consistent result, and most importantly, there's a lower risk of infection because in the going through armpit, there's a lot of glands and dirts inside of your armpits and around your nipples. In the milk duct, that's where some bacteria hide sometimes. So if we go around the nipple area complex, your risk of infections goes up a little bit. So those are the approaches that we talk about, and we talk about the volumes and what else you need to do if you come for a consultation, and then we talk about your choice of silicone or saline or ideal implants, which is all saline that's supposed to feel like silicone. To be honest, I only did 2 cases, and it takes more time. It's more challenging than putting the silicone implants in. By the way, I put my silicone using the Keller funnel, so it's minimized the infection, and also I washed the breast pocket with a lot of antibiotics. So courtesy of the the Anderson's Medical Center, M.D. Anderson Medical Center. Okay. So I'm gonna just open that up to questions right now. Oh, one more thing we forgot to talk about is that we also do anatomic implants, also called gummy bear, and you can see the shape here. Okay. This is actually a little bit more challenging to place because the dissection of the pocket and the placement of implant have to be precise. Because otherwise, if the implant's rotated one side or another, even just 5 degrees, the breast may look a little bit different. Okay, so therefore the cost is a little bit higher, but many patients are satisfied with the result, and they kept asking for them. Okay.
All right, doctor, do you want to go over a frequently asked question, which is who can benefit from getting either an augmentation or a breast lift?
I kind of touch on that. So we talk about patients who have breast hypoplasia or like smaller chested, smaller breast patient who has tuberous breast deformity, where the base of their breast is constricted and they have basically almost like a tube projecting outward. Those patients would benefit from breast augmentation, and when your breasts are kind of sagging, then you need a lift, and if your breasts are small and sagging at the same time, you would need both augmentation and a lift. And then the new things that I've been doing lately for patients who I remove implants and then they don't want to have implants anymore is to do fat transfer. Basically, I do liposuction of their abdomen back, making the waist a lot thinner and smaller, and then use that fat and transfer to the breast or to the buttocks. To the buttock is called Brazilian butt lift. To the breast is breast augmentation with fat, and it feels pretty much natural, and you don't feel the shell of the implants anymore. So this has taken off in Europe, South America, and Asia, everywhere. In America, we're slowly adapting these kind of things. And just another day, a patient asked me if I have nano chip implant. I'm like, whoa, what do you mean? Nano texturing like in France? No, but nano chips. And this basically they have this company now in Europe and South America. They put nanotechnology chip inside the implant. Supposedly, it's supposed to detect when the implant ruptures. So, quite interesting, progressive, forward-thinking implant of the future. However, in the U.S., it's gonna be very hard to pass FDA, and who knows if those chips are detecting, locating us for some. For some reasons, okay, let's just say, okay, that patient A has nano chip technology in the implant, so they can basically track that patient if they know the SDU code or something like that of that nanotechnology implant. So it basically is almost touching on the violations of privacy in the U.S. and it's kind of frowned upon. So I don't know. I think it's great technology. It's good for talking point, but there's a lot of social legal aspect that will come into this theater in the future. So we'll just have to wait and see. And I'll try to catch up on these kind of technology and keep you stay tuned.
All right. Someone asked, can you talk more about lifting and volume?
Oh well, so. Volume, meaning if you're let's just say you're an A cup, volume is adding an implant to increase from an A cup to a B or C or D cup, and on average, it's, 250 cc per cup size increase. So if I want to go from A to B, I just put in 250 cc. I want to go A to C, I put in 500 cc. Lifting is like I said, not only that your breasts. So look at the nipples. If the nipples is below the fold of your breast, then your breast is sagging, and therefore you need a lift. So a lift is by making cuts in the skin, moving your breast tissue around without removing your breast tissue, and making your breast more perky. So that's a lift. So if you have small breasts but saggy nipples and breast tissue, then I can do a lift, but you don't have any projection, and your cup size will not change. So you may need volume with augmentation. And then let's touch on breast reduction. There's some women who have very large breasts that hurt their neck and their back. It just interfere with their daily living activities and such as exercising and stuff like that. I also reduce them, but in this case, it's different from the lift. Is that I also remove some breast tissue. Okay, so those are the difference.
Great. And how do you know what size would be best for you?
Well, it's very subjective. So it's subjective. So that's why we have the sizing kit in our office, and that's when you go in and you try them out. Now there are some offices, they have Vectra 3Ds where you go in, they take pictures of you and 360 degrees, and then they manipulate and see how you would potentially look if we put certain size of implants in. I don't have that technology because I just don't have that technology, and we can, that's just a ballpark, and it's we don't when we truly operate in the operating room, the result, we get to about like 95% of what this 3D imaging would kind of indicate, but we cannot be like delivering like 100% of the time. Maybe I cannot, but someone else can, but it's kind of hard. However, I find that these sizing implants sizer are doing a great job, so that's why I don't consider investing into Vectra 3D imaging technology. But this will give you a very good, you know the texture when you put it on, and you basically know how you would potentially look by looking yourself in the mirror, in our mirror, when you come here for a consultation, and just feel these out.
Okay, and then in terms of lifting without augmentation, how about if the size is okay and the skin is not tight enough?
Then you tighten the skin. Keep the size. Yeah, you can always tighten up the skin some more. If you have that issue, let's come in. I'll take a look and I'll tell you if you need something done. Maybe you don't need anything else done.
Okay. That sounds good. Can you talk a little bit about downtime after surgery? And
Well, the breast augmentation. So to be honest with you, people when I went to meeting and other people talk to me about the downtime, they say, oh, you can pretty much move your arm and just go shopping the same very night. To me, I feel that it's in some patient, if you start out with moderate sized breasts, and with some loose skin, then you put in the new implants, you can pretty much feel comfortable, like get back and walk around, do whatever you want to do that same very night. But if you have a flat chest and we have to put something in that stretch your skins out, and that will create a lot of pressure. So you might not feel comfortable for the next 2 or 3 days. So again, it's subjective, but usually the downtime for breast augmentation is anywhere from 1 to 5 days, to be honest. With primary breast augmentation, that means you get augmentation for the first time. You're not gonna have any drains or anything like that, and usually you should be back on your feet that same very night. I do not recommend doing any heavy lifting for 6 weeks. This is just typical for all surgeons because the incision can open and then the implant will be extruded, and by definition it will be infected. So, okay.
I think that might be all the questions for now.
All right. Well, just my staffs are standing by, and just you have any further question, feel free to send us a message or send us an email, give us a call. All right. Thank you. I gotta go, but any more question?
And that's it for now.
All right. Thank you. So thank you for tuning in, and this is Dr. Tuan Tran. Very excited to always engage with potential patients or all patients or anyone who have an interest in plastic surgery. We're always here to help. Remember, all of our consultations are free, and you don't even have to come in. Just send us an email or go to our website at tranplastic.com and just book your consultation that way, or send us an email for just fill us out and then get some question answer. And then the way how it works is that if my staff cannot answer some common question, they will bump it to me, and I'll try to get back to you and answer your question as soon as possible. Okay? Thank you very much, and have a good day. Thank you.